Hey, so in reply to Kelly Vargas's comment, can you post a video about after the 30-day mark? I feel like my sides are too big. I'm going tomorrow for another reline, but I think I need them trimmed and it's a dental assistant that does it. Okay, so let's talk about 30 days moving forward. So this is a time when you really get frustrated. You know, the pain has really subsided from the extractions, but now you're wearing dentures that are rapidly getting loose. So I can only speak to what I do in my practice, but in my practice, at 4 to 6 weeks out, depending upon the patient, I let the patient tell me at that 4 to 6 week mark when they feel like their dentures are getting really loose and really unstable, and they might be getting sore spots, that they need another soft reline. I offer these in conjunction with the immediate dentures. So I charge $1,200 for one immediate denture. Included in that price is those 2 soft relines and any and all adjustments that happen during that first 6 months. Then I give them more time. But anyways, so at that 30-day mark, you're going to start to feel like these dentures are so loose. The lowers won't stay down. The uppers are a little bit more tolerable because you get a little bit of suction even though they're loose. So this is a time when you're starting to really be able to eat different things, but now the denture's loose. So I would suggest that you talk to your provider about getting adjustments or another soft reline, and this is why. So at that point, the tops of the ridges, so where the teeth were pulled, those start to really shrink down, and so the denture moves down into that space, or the upper, you know, where this has shrunk, that denture starts to move up in this space, and then you start to feel a lot of pressure along the edges of the dentures because the dentures are moving down into that space and the edges are really smashing down onto this area here, onto the top of the chin, which is very, very sensitive around there, and sometimes even under the tongue. On the uppers, the edges can start to really feel really painful up in here. There's a pressure point right here under the nose, and that can be really, really sore up here on the tops of the cheeks. You know, when a patient comes in at this time, I have them remove the dentures, and I take my light and I look in their mouth, and typically I will see some sore areas, even the little tiny capillaries, the little vein, you know, that are in your cheeks, those will be red and inflamed because those dentures are just sitting too hard against those areas. So a lot of times I will take down the edges of the dentures, shorten them up a bit, shorten the tops up a bit, and then do that soft reline. Every time I do a soft reline, I want to put it in there very, very thinly because I don't want to thicken the dentures up too much. But I hope this helps. At that 30-day mark, you're probably going to feel really, really loose dentures. Wait as long as you can, get adjustments during that 30 to 45 day window, get the adjustments to kind of shorten them up, and then maybe at that 45-day window, that 4 to 6 week time period, have the provider lay in that soft reline material, and it's going to relieve you a lot. And at that time, if you have to wear a little adhesive, that's fine. Do what you need to do to get by. You know, the cushion grip, if you need to use it, it's not my favorite thing, but a little bit goes a long ways. Do what you need to do to make yourself feel comfortable. And I'm here, always reach out to me for questions. When patients and users on this platform want to reach out to me, honestly, I give you probably a lot more access to me than my regular patients, because you can send me a direct message in TikTok, and if you want to show me a picture of what's happening, then I give you my email and you send me those pictures and I'll look at them and get back to you. All right, guys, I'm here to help and I really enjoy doing it. It makes my heart feel good. Thank you so much. Have a great day. Bye-bye.